like what some people say, empowering. Because if you one day have no menses, then maybe you're quite happy with the fact that you have no menses.
Less trouble. Hi ladies above 40, are you suddenly feeling like a stranger in your body with mood swings, maybe even hot flushes? And if you're wondering, hey, what's happening to my body? Today, you are in the right place. We have Dr. Sue with us to talk to us about perimenopause and menopause. Dr. Sue, thanks for joining the podcast, the Prologue to Wellness podcast. Can you tell us a little bit more about your practice and your area of expertise?
Sure. Hi, Cheryl. So I've been a doctor for more than 20 years now, and I have a very keen interest in women's health. So today we'll be talking about perimenopause and also menopause. And I'm happy to answer some of your queries.
Yes, thank you so much. Because I have a couple of friends who asked me before, or rather when I tell them or say the word perimenopause, they will be like, what's that? Can you tell us what is perimenopause and what is menopause in layman terms so that we understand?
Okay, so perimenopause is the stage before menopause.
Okay.
So basically it means the people will start experiencing irregular menses.
Okay, irregular menses.
Hot flushes.
Hot flushes.
Maybe some mood swings. Insomnia. Then they start to notice maybe their hair is like they're starting to lose a bit of hair. Yes.
Okay.
And ages is 40s.
In your 40s?
In your 40s. But there are some cases I've known women, I have maybe met one or two women even in their 30s, their late 30s, they started
in their late 30s.
perimenopause.
Perimenopause,
yes.
Okay.
Menopause, on the other hand, is basically, you stop having your menstruation for almost a year, and then you have all the symptoms I just said.
Okay.
Yes.
Okay.
Yeah.
What if, let's say, for someone who always has irregular periods, always have insomnia, always have hair fall, and so on and so forth, how do you know for sure if you're perimenopausing or menopausing?
Okay, so besides the symptoms, you can also come to see a doctor and do a blood test.
Okay.
So the blood test will check for the hormone levels, like the progesterone and estrogen levels. So that is one way to be very, very sure if you are experiencing, the perimenopause or menopause stage. The other thing is you can also look at symptoms. So for example, if you always had irregular menses but the amount is always the same, then maybe it's not the perimenopause. For example, women who perimenopause, the amount may have lessened a lot more than before. Yeah.
So it's kind of like changes in your cycle that you can observe on your own. Okay.
Yeah.
Okay, Dr. Sue, since you're here, can I have a consultation with you, please? As a lady in my 40s, facing maybe potentially some symptoms around menopause, what should I do? First step, second step, third step, teach me.
So first, if you are coming to my clinic, I will ask you what sort of symptoms are you experiencing? Have you experienced any hot flushes?
Yeah, there's one questionable. Maybe I had some hot flushes. My periods are getting longer and less.
Okay. Anything else?
That's it. I
That's
think.
it. All right. Okay, so one of the things I can recommend is to do a blood test, a hormone blood test to check your progesterone and also the estrogen levels.
Okay.
After that, if we have already maybe concluded that you have perimenopausal stage, then we can move on to helping you to see what we can do to help you to improve the quality of life. But just say we found that you have perimenopause, then the other options for you is to do an in-body scan, where we can check for your muscle mass and maybe the bone density. If there's something wrong with that, then we can send you to do a proper bone density scanning.
Okay. So let's say if someone has got these symptoms that you mentioned, and they feel very uncomfortable and they want to see a doctor, what's the first thing they should, or you would tell a patient to do? Okay,
so a lot of times when I do meet these patients, I think the first thing is the hot flushes, obviously, and then the mood swings and insomnia. So a lot of times, because of insomnia, it causes them stress and they're unable to sleep, and then maybe it will affect their quality of life, their family, and then also work. So for hot flushes, there's nothing really much you can do except to hydrate. Maybe drink cold water, or drink more water, and avoid caffeine. I mean, especially closer to the bedtime, and also alcohol. I think it's very important. Is changing your lifestyle a little bit. And then the other thing about mood. Now, what can I recommend? I always recommend exercising. Why? Exercising releases endorphins.
Yeah, you feel good.
Yeah, exactly. Then it also tires you maybe. Then it make you sleep. So it will also, like, help with the insomnia.
Yeah, I have actually one personal question, which is about like hot flushes. So I don't know if I actually experienced a hot flush the other day, but like, can you explain or describe how, like, I mean, we see it in movies, right? When a woman has got like hot flushes, they would like open the fridge and then they try and let some cold air in. But how does it actually feel like, and how do you know that it's not normal? Like it's not the weather,
Okay, so I feel a lot of my patients actually tell me, like when they're sleeping at night in an air-conditioned room, all of a sudden they feel like they're in a sauna. They'll be sweating profusely.
They'll be sweating in an air-conditioned room.
Yes, that's one. And then they feel very agitated, or maybe in the middle of the night they have to remove their blankets because it's too hot.
So is their body internally feeling?
Yes, it's their body because of the hormonal changes. That causes this.
Okay. So it's not the same as, say, a hot weather and then you feel that.
Yeah, I think if it's the hot weather, it's very difficult to differentiate, I feel. But when you are like relaxing at home, or you are in just say, for example, you're sitting here, you're not sweating. And all of a sudden, you're just sweating profusely. That could be that.
Okay.
The way of knowing.
Okay. And that could occur during your perimenopausal years leading up to.
Yes, on off, you suddenly feel like, you'll be maybe watching a movie, for example, it's an air condition, or you're in a shopping mall, and then suddenly you just
sweat for no reason.
So for no
that
reason.
is very abnormal. Yeah. It's not normal. Okay. I'll look out for those signs. Another question that we were just talking about with the girls the other day, like, when you have your perimenopause, when you go through perimenopause, there is also dryness, especially like say in the vaginal area, right? And I think there's a lot of discomfort, sometimes even itchiness, and like what are some of, I think one question that we're talking about is whether you can still have intimate
like sexual intercourse.
Yes.
Okay.
Actually can or not?
Yes. Okay. So definitely the answer is yes, you can. So one of the ways to help is, I would recommend my patients to get lubricants.
Okay.
So, you can, like example, everybody knows this brand, right? Yeah. So that's one example. The other thing is like there's also hormone replacement therapy in topical form.
Like a cream?
Like cream, gel.
A gel, spray. Oh, really? Yeah. All sorts of ways of,
Yes, so that's one option. Obviously, there's also the oral, hormone replacement therapy. Not my favorite thing to give out as a first line treatment. But obviously, if the patient has this problem for many years and is really affecting the quality of life, then I would maybe prescribe oral hormone replacement therapy.
Okay. And you mentioned that it's not your favorite, and could you share a little bit more?
Well, it's got side effects, right? One of them is the ones that I don't really like is the cancer side effects. So there may be increased risk of breast cancer, ovarian cancer, and also the uterine cancers. The other one is blood clots. So it also maybe increase the possibility of getting blood clots, a deep vein thrombosis, for example, and stroke. But the stroke one is, the possibility is actually low, but still there is
some risk, right? Okay. So the other episode that we had with Dr. Odelia, we also spoke about lifestyle medicine, which is also a little bit about what you're touching on, which is, I guess, adjusting our lifestyle to cope with the symptoms. Are there any other natural means that one can do to cope with the symptoms of menopause?
Yes. Besides, I told you exercise and things and drinking water, you must also change your diet. So you have to take more vegetables, fruits, maybe high protein, and then increase your calcium and vitamin D. I think that's very important because I think a lot of us, when we go to the menopause stage, then the problem of osteoporosis can occur, like fragile bones, and we want to avoid like fractures and osteoporosis. So that's one way is to increase the vitamin D and calcium intake. exercising also increase muscle mass,
mass.
right?
Okay.
And then that will actually help with the bone density, because we want the bone density to remain as
compact, as strong, and like
yes, to avoid osteoporosis.
And all these are like related to this age group where
Yes.
there's a tendency of that. Okay, Dr. Su, we spoke a lot about like conditions that aging people would have, like osteoporosis and stuff like that. But are there any female-specific conditions that we should be aware of?
Okay, so a lot of women that have hit menopause may complain of incontinence. Okay, some of them may even have like pelvic organ prolapse or genital urinary symptoms.
Okay, can you explain to us, like, incontinence to me sounds like it has to be very serious, like, but are there signs that are more commonly observed in women?
Okay, so for how we address incontinence, so there are a few types of incontinence, like stress incontinence or urge incontinence. So there is like questionnaires that doctors will ask the patients to fill up, then we can decide between the two. I'll give you an example. So for example, you just suddenly sneeze,
yes,
right? And then if there's a leak, that's like what we call a stress incontinence. So there's also people who are just like walking around, and then they are actually knowing they want to go to the toilet, and they're heading towards the toilet, and then before they even reach the toilet, they leak.
Okay.
So that's like an urge incontinence. So there are different types of incontinence. Our pelvic floor organ prolapse is a little bit different. It's like, for example, certain organs like the uterus has gotten lower or hanging lower, and then it causes problems because when it goes lower, it goes towards the vaginal opening, and then it really causes a discomfort for the sufferers. And genital urinary symptoms is basically saying all the symptoms such as vaginal dryness, like after menopause.
So, Dr. Su, besides like all these natural ways, let's say I've tried all sorts of natural ways, but I still need some added help and support, especially for things like incontinence, prolapse, and what was that you mentioned?
Genital
urinary symptoms.
Yes.
Like, what can I do?
Okay, there's the option of lasers. There's now lasers available
For the vagina area.
Yes, for the vaginal area to tighten. It's like a vaginal tightening lasers.
Okay.
The other option is also there are like machines to help strengthen the pelvic floor muscles and ligaments. So these are some options that you can consider.
Okay.
Yeah.
I think there are options that are also non-surgical, right? So these are all non-surgical.
Yes, these are all non-surgical, and it's quite helpful for those with moderate or like
milder
yes,
issues.
exactly, milder.
Okay. So these are just all so that I know how my body is doing, and but I can't stop it from happening.
Yes.
Or can I lengthen or no?
Yeah, unfortunately, this is like a natural way for like the women. I think, this could be like what some people say, empowering. Because if you one day have no menses, then maybe you're quite happy with the fact that you have no menses.
Less trouble.
Yeah, but at the same time, I also notice there's a lot of women in their 40s that are starting to be more in tune with their their lifestyle. They want to be more healthy, and they want to eat better. I noticed that they're starting to change in their age.
Yeah, no, I totally agree with you. Like, I think women today in their 40s are a lot more aware, and because maybe that's also the age where they have their kids are all grown up, and they now have more bandwidth to take care of themselves. So I think we always have this misconception that menopause is, I think it's the movies actually, where they show this old lady that is like grumpy and I think society has a certain view of menopause, but I'm glad that you're sharing all this today with us. Like, menopause shouldn't be like this. In fact, it could be like what you said, the best time of your life, right?
Yes.
Yeah.
We shouldn't be afraid of menopause. I know a lot of people are afraid, they're scared losing hair, dry skin.
Or they will suddenly age, that's what they say.
Yes, exactly.
Yeah.
But I think, if we take care of our diet, and we exercise, we sleep well, and try to reduce stress, I think that may actually help. And I see that a lot of women in their 40s or 50s actually they don't look their age.
Correct, that's true. These days, yeah. So there's help out there, and you don't really have to really suffer in silence. I'm thankful today that I've got a consultation for myself, but I'm sure you guys have also, or you ladies have also understood a little bit more about perimenopause and menopause. Thank you, Dr. Sue, for sharing with us. And that's all we have today for the Prologue to Wellness podcast. At Prologue, we believe that healthcare deserves a new narrative, and we're glad that we're able to share really sensitive topics, and we're sure that if you have any questions, Dr. Sue would be more than happy to answer. So leave your comments, and we'll take them at the next episode. Until then, take care and be well.